Bismillahirrahmanirrahim. This is our second session about the problem-based learning, and in this session, on the basis of first session, I will encourage you people. I will not teach. This session is not teacher directed. My role is just as a facilitator, and you people will answer on the basis of your knowledge of FSC and the knowledge that we have obtained in the classrooms. And I will encourage every student to participate in it. So, the learning objectives of this lecture are that you become familiar with the basics of PBL, develop your approach to think about clinical approach to solve the disease. You will be able to explain different mechanisms that are altering cellular, organ, or body system response in different problems that we are going to discuss. You can also be able to explain what basic questions should be in mind to solve a clinical scenario. Now, the first is just a brief summary of the first session. That is what we need to solve a clinical problem. What we need to do in problem-based learning. Three approaches are required. Number one, learn physiology and apply physiology. Second is disease. What is needed to reach some diagnostic point? Some diagnostic point means that what problem is present. Then, after studying the first two things, from where to read, from where to learn further. So, the first approach to learn physiology is by understanding the cellular and macroscopic processes of the body. The knowledge of physiology is basically achieved by understanding the cellular mechanisms that are involved. The student means you people. You should strive to learn the underlying rationale, such as, and to develop that, you need to understand. You need to understand, not to memorize. Like the cell membrane allows passage of some molecules and not others. Means the cell membrane allows movement of some molecules. The cell membranes of some cells, they allow movement of certain molecules, while they do not permit movement of other molecules. What do you people do? You go for ratta. That this is feature of cell membrane, that some molecules they can pass through the cell membrane while the others cannot. Now, on the basis of this, the cell membrane allows passage of some molecules and not others. Now I am the facilitator. You will tell me that what mechanisms are present behind this statement. I need answers from you people. I need contribution of you people. So anybody? Yes.
Assalamualaikum. The plasma membrane of the cell is a selectively permeable membrane and it is mainly composed of a lipid bilayer and certain proteins which are embedded in the lipid bilayer in a mosaic manner. So the substances which are fat soluble can easily cross a lipid bilayer, but the substances which are water soluble cannot cross a lipid bilayer, so they have to move through certain protein channels or carrier proteins. So yeah, this is the main process.
So anything else that you want to contribute?
The passage of materials across the plasma membrane depends upon their concentration gradient. For instance, if the substances are going down the concentration gradient, then it is passive transport, which includes the facilitated diffusion or maybe the simple diffusion. But in case it is against the concentration gradient, then it requires the utilization of energy in the form of ATPs, and it is called active transport, which includes the pumps, etc. Thank you.
Anybody else who want to add further knowledge to this? Yes, please.
As concerned for the larger molecules which have passive size, so they cannot move through the channel proteins because their pores are not enough big. So they are moved by some other processes such as exocytosis and endocytosis.
Thank you. Very good. So anybody else who want to add? Yes.
Cell membrane have been evolved in such a manner that it allows only the specific molecules or substances to cross it, because otherwise life would not have existed. There was not a plasma membrane. Plasma membrane is just like a boundary of life. It is an edge of life. Plasma membrane allows useful substances. Plasma membrane is like an edge of light and it contains all the molecules or substances which are essential for life, and it tries to keep back those molecules which are harmful for the life. Therefore, there have been control systems have been evolved in plasma membrane which actively or passively transports or pushes out those molecules which are not essential for life. For example, in a hypotonic environment, when there is a large amount of water, and a large amount of water would be dangerous for the life of the cell. So control systems have been evolved in such cells to remove the excess water, so that uh, water intoxication or other complexities which could have occurred due to the excess of water in the cell could be prevented.
Thank you. So what else we can add to this information? So up till now we have talked about lipid bilayer. It is present. It is selectively permeable. Then protein channels are present through which water and the molecules that are soluble in water can move. Then concentration gradient. Do you think there will be any effect of pore size? So what is that effect? Anybody? Yes.
If the pore size will be large, if the macromolecule which has to cross the membrane, if it is larger than the pore size, then it will not cross it. And for bad macromolecules, the process is usually endocytosis, which includes phagocytosis and pinocytosis. However, if the molecules such as water molecules, they cross the membrane through aquaporin channels, because it is a very small molecule, so it's very easy for it to cross the membrane.
Thank you. Good. So, is there any role of charge on the molecules regarding the movement? What is that exactly? Anybody? The proteins that are present In the body, they are usually negatively charged, and the inside of the pores are of protein molecules, it is also negatively charged. And the negative charge, it repels negative charge. Then the charge is also about the what charge is present inside the cell and what charge is present outside the cell. So if the negative charge is more inside the cell, there is a natural tendency, and the positive charge is more outside the cell. There is a natural tendency for the positively charged things like the sodium ions, as it is more in the extracellular fluid, to move inside the cell through, not through the lipid bilayer, but through the protein channels. But through the protein channels. So the next, the second approach is approach to disease. The physicians, they tackle clinical situation by following questions, by following questions to reach diagnosis and identify disease. So these are the questions that the clinicians they ask, and these are the questions that from first year, by applying your basic knowledge to clinical scenarios, you must keep these things, these questions in your mind. And what are these? You will take history, you will perform a physical examination, you will obtain or order certain tests, and you will formulate a diagnosis, and you will initiate a treatment plan. Now, this is not for you people, for first year or second year students. But if there is some epidemic, yes, you people are also being involved. You can be involved being medical students to help the doctors. So you must be able to initiate the treatment plan on the basis of the cause. Now the scenario is a new young medical student is brought with vomiting and diarrhea. He is unable to walk due to weakness. So, on the basis of these questions on the left side, what will you ask in the history? Anybody from your side? Yes.
First of all, I'd ask them that what they ate and from where they ate. And the second question from the patient would be that for how long have they been experiencing the vomiting and the loose bowel movements?
Thank you. So, what about a physical examination? What will you see in your patient? As the fluid is lost in vomiting and in diarrhea, the fluid is lost from the body. Which examination you will perform? Yes?
Because we are experiencing weakness in the patient, so the first step would be that we record the pulse rate and the blood pressure, and then we'll also check the temperature of the lower and the upper extremities of the body.
Thank you. So, as the fluid is lost, so you must check blood pressure and pulse. So, what tests you will advise on the basis of the knowledge that your patient has vomiting and diarrhea? What is fast in the diarrhea and the vomiting? Yes, Ji, please.
So we will definitely require a blood test, and through the blood test, we will evaluate the ions and the imbalance that occur due to diarrhea. The ions that we will focus on will be sodium, potassium, and calcium ions, so that we can move further on with our diagnosis.
Yes. Blood levels of sodium, potassium, and calcium, as you told. As you told. So, as the fluid is lost, and in the fluid, what is present? Ions are present. And what are the common ions? These are sodium, these are potassium, that are necessary for the cellular function. Then, how will you formulate your diagnosis? Yes? Give him, give her money.
So I think the patient could be suffering from diarrhea-related problems such as cholera or food poisoning.
Food poisoning. So, your diagnosis on the basis of vomiting and diarrhea is that your patient is having food poisoning. And in medical terms, we label it as gastroenteritis. We label it as. So, what treatment plan will arise in your mind? Yes, anybody? On the basis of all these findings, that the fluid is lost, the ions are lost from the body, he is having weakness, what treatment plan would come in your mind? Yes?
So basically, since the patient has lost a lot of electrolytes and ions, so we'll try to maintain the electrolyte balance in the patient by treating with the fluids and also some antilaxatives.
You will replace ions and
Electrolytes.
fluid that is lost. And what will you do? You will give ORS if the patient cannot, if the patient can take, you will give ORS, बिल्कुल ठीक है. And if the patient is still vomiting, in spite of giving ORS, then you go for the intravenous fluids. Then you will go for the intravenous fluids. Now, approach to reading and application of basic sciences knowledge to clinical setting. So, when we move through this third step, these are the 6 questions that you must keep in your mind. Number 1, what is the likely mechanism for the clinical findings? What is the likely cellular response to a certain change in environment? With the biochemical findings noted, what clinical processes are expected? Think what is the likely disease process? What is the likely cellular mechanism for the medication in life? That if you have started certain drug therapy, what graphic data best depict the physiological principle? So these are the 6 basic questions that always be in your mind to solve a clinical scenario. Now we will move through the first question. Now, what is the likely mechanism for the clinical findings? Our scenario is, our scenario are the PBM is a 20 years old man presented with fever and severe body pain. Laboratory tests revealed low platelet count. Now, what are the trigger points? Now, this is the trigger points. Fever is trigger point. Body pain is trigger point. The platelet count, low platelet count, it is the trigger point. That how low platelet count is related to fever and body aches. Now, my question is that I am asking from you people, that how will you find clinical manifestations by keeping in view the mechanism? Clinical manifestations mean what will you see in your patient? What will you note in your patient? By keeping in view the function of the platelets. Yes. Anything that comes to your mind? Yes? What is the normal function of platelets?
Platelets help in blood clotting when the patient is suffering with fever and
Severe body pains
severe body pain
and having low platelet count.
and having low platelet count. In this condition, the patient is suffering from fever and platelet level is low due to its low body temperature and white blood cell count increase and prostaglandin.
No, okay. So the function of platelets is blood clotting. That is what you have been taught in the SSC. Now, if the function of platelet is disturbed or the count of the platelet is decreased, if the count of the platelets is decreased, the first question in your mind, it should be, blood clotting will occur normally. You are saying no. So how much level of platelets should fall to cause this issue, that the blood clotting becomes abnormal? Like minor holes are produced continuously in our blood vessels. They are produced continuously in our blood vessels that are sealed by the platelets. That are sealed by the platelets. Now, if the platelet count decreases, the normal range is 150 to 300,000. So, if the count decreases less than 50,000, then there are chances of bleeding from the minor holes that are produced in the vessels. And how will they appear on the skin? In the form of how they will appear. That is in the form of spots. And what will be the color of those spots? Red. It will be red. So you will, in the examination, you will specifically note spots whether they are formed on the skin or not. If they are not present, then your patient is safe. If the spots are present, then your patient is in severe trouble. Your patient is in severe trouble. So this is how you approach towards the disease. What will be the likely response of the body mechanism? What will be the response of the body mechanism to restore platelet count? Yes? Any idea? Where platelets are produced? They are produced in the bone marrow. And what will be the effect of low platelet count on the bone marrow function? Yes, anybody?
Its function, its function will increase as there is the environment and the needs of platelets.
Yes, very good. So bone marrow will start bone marrow start more synthesis of platelets. So what is the likely cellular response to a certain change in the environment? This is your third question. So what is, for instance, during an overnight fast, when serum glucose levels fall, it leads to hypoglycemia. It leads to hypoglycemia. When the blood level falls in fasting condition, the body mechanisms, the regulatory mechanisms, they become active and they try to restore the low blood glucose level to normal range during fasting. How? So first, which regulatory mechanism will activate? G, what is your question? What is your answer? Do you have any idea? Yes?
Sir, in actual, the blood glucose level in our body is controlled by two hormones, pancreatic hormones, glucagon and insulin. So here is the condition that glucose level falls. So glucagon is a hormone that maintains the glucose level by converting glycogen into glucose, because glucose is the primary source of energy and we need energy in the form of ATP. Conversely, if we see that antagonistically, if glucagon is working and glucose is released in our blood, so what will happen? Ultimately, blood glucose level will increase. So, maintain that in point, insulin will start working, and that it will convert glucose into glycogen again, and it will be absorbed by the cells again. So, the blood glucose level will be maintained.
Thank you. Very good. So during fast, the insulin secretion it decreases and the secretion of glucagon increases from the same organ. Which organ? Pancreas. It is pancreas. So what is the role of glucagon? It increases blood glucose level by involving different mechanisms. So, what are those mechanisms? It causes breakdown of stored glycogen, and that process is called glycogenolysis. And it will also start synthesis of glucose from non-carbohydrate sources. That is called gluconeogenesis. Excellent. So, what is diabetes mellitus? Diabetes mellitus is most common disease, one of the most common diseases, and its number is increasing day by day in our population. And it is a disease in which the blood glucose level becomes more. When blood glucose level it becomes more, it directly affects our eyes, it affects our heart, it affects our blood pressure, it affects our kidneys. So diabetes mellitus affects every system of the body. It affects every system of the body. So which cellular organ response is altered? So, if anyone knows, raise your hand. Ji, yes?
So diabetes mellitus is primarily an endocrine disorder. There are two types, type 1 and type 2. Type 1 is actually an autoimmune disorder, and in that the cells of the beta cells of islets and Langerhans are affected. They cannot produce insulin. It is especially in young adults and young people. The type 2, which approximately covers approximately 90% of the population affected by diabetes mellitus. In this case, actually the most common reason is obesity, and obesity causes insulin resistance. So the body can produce insulin, it does produce insulin, the blood has high insulin levels, but the cells are not able to respond to it properly.
Very good, excellent. So, in diabetes mellitus, there are two types. Type 1, it occurs in children, and it is due to deficiency of the insulin that moves glucose from the blood vessels into the cells. So, there is deficiency of insulin. Why it occurs? As my daughter told, that it occurs due to destruction of the beta cells of the pancreas. The second reason that is present in type 2 diabetes mellitus, the insulin is present, but insulin cannot act on the cells. It cannot act on the cells, and the cells becomes resistant to the action of the insulin. So insulin resistance develops. So with the biochemical findings noted, what clinical processes are expected? So for this, we need to understand what biochemical change is present, which cellular mechanism is disturbed, what are the subclinical changes, and what will be the clinical symptoms. So pain, fatigue, and bleeding when platelet count is low. What biochemical tests you need? You need biochemical tests to test the bleeding profile. Bleeding profile means how much is the bleeding time? How much is the bleeding time? How much is the clotting time? For assessment of that, we perform prothrombin time and APTT and INR, International Normalized Ratio. So these are the tests. Clotting time, bleeding time. These are old tests. Now, new, these are prothrombin time, APTT and INR. So, which cell is involved? It is platelet. It is. What will be the subclinical changes? It is according to the function of this. And what is that function? The blood clotting. It performs blood clotting. It may be disturbed. If it is disturbed, what will be the clinical symptoms? The reddish spots. Reddish spots will appear on skin. So pain, fatigue and bleeding when platelet count is low is feature of a disease that remain epidemic in our population. Many deaths occurred in the past due to this problem, and that occurred due to dengue. That occurred due to dengue. And what is the name of that pathogen? Anybody among you? Anybody? दे दो इधर दे दे माइक Is it male or female mosquito?
Female mosquito.
It is female mosquito. So, the next question. Think what is the likely disease process? Like in case of left heart failure. If left heart failure is present, what will be the disease process? What is, think about this on the basis of functions of the left heart. The function of left heart is, anybody among you? Anybody? Yes, give him mic. What is the function of G?
Left heart primarily receives oxygenated blood from the lungs.
Thank you. Anybody else? Yes. So left heart it pumps blood. So if the left heart is failed, do you think the blood will be pumped? No. The blood pumped by the left heart, it moves through the circulatory system. It moves through the circulatory system. And when it moves through the circulatory system, what it provides to the cells? Nutrients plus oxygen. And what symptom will appear? Due to deficiency of oxygen. Yes. Hypoxia. Yes, it is hypoxia. That patient will suffer from deficiency of oxygen, and what patient will tell you? He will tell you that he is suffering from shortness of breath. He is suffering from shortness of breath. Like in case of right heart failure, what is the function of right heart? Yes?
The left side, it receives
But what is the function of right side of the heart?
the right side receives the deoxygenated blood, so that blood will contain carbon dioxide, and it pumps that blood to the lungs so that it can return with
So
the
if it is not pumping blood to the lungs,
yes.
what will happen?
The blood will not
Where that blood will go?
that blood would go to the lungs, and but it
No.
will remain in the heart
It will remain either in the heart
or in the veins.
or in the veins. If it remains in the veins, what will happen? There will be swelling. There will be pooling of blood in the veins that will appear in the form of swelling. Why? Because the hydrostatic pressure will increase and fluid will move out of the blood vessels, and that will appear in the form of swelling. And where that swelling can be checked? G, give her mic. Where you can check? You can check feet, ankle, and legs. Thank you. So, what is the likely cellular mechanism from the medication effect? Law. So, in left-sided heart failure, there is weakness of the left heart. That means left ventricle. So, what measures we can adapt? Yes, give him one.
Different kind of drugs can be used to stimulate the heart and increase the force of contractions of the heart wall. For example, the cardiac glycosides that are monosaccharides derived from a plant called digitalis are used. They increase the effectiveness of the heart contraction by increasing the calcium concentration in the cardiac muscle cells.
Thank you. So, you need to give your patient some drug that can increase the effectiveness of heart pumping. So, such drug that you have discussed in the cell module or in your FSC, on the basis of your FSC knowledge, it is cardiac glycoside. That is monosaccharide. That is monosaccharide. So, it increases the pumping ability of the heart. So, in right-sided failure, the problem is swelling in the feet, ankles, and leg. What you need to give your patient such a drug that can reduce this swelling. And how can you reduce this swelling? You cannot reduce this swelling by producing cut. So you need to give your patient a drug that increases the urine output. And such drugs are called diuretics. Such drugs are called diuretics. So the last thing is, if on the basis of investigations you get some graphic data, to interpret that graph, you must be in mind what is the normal graph, what is the normal data. Like this is the graph that is shown to you people about the respiratory problems. In respiratory problems, there are two types of diseases. In which the one type of disease in which there is a restriction. Restriction means restriction to the entry of oxygen into the lungs. And in the second condition, there is obstruction, in which you cannot expire normally, in which you cannot expire normally. And we test these things with the help of a machine, with the help of a medical instrument that is called spirometer. With the help of a spirometer. So this is the normal diagram. This is the normal diagram. Now on the basis of this normal diagram, in case of a restrictive pattern, what you can see? That as compared to this graph is shows less values. Less values of which thing? What is written on the slide? It is FEV1 and FVC. So these two they decrease. One is volume, one is capacity. While in contrast to restrictive disease, in case of obstructive disease, what you are appreciating? That this is the arrow. That is showing level of forced expiratory volume in first second. That is FEV1. Is it same as in case of obstructive disease? So in obstructive disease, this FEV1, it is noted that it is decreased. It is decreased. In the same manner, FVC, so it is also decreased, but it is decreased less. It is decreased less. So this is about how you will approach in the future classes, about the clinical scenarios, about the problem-based learning. By understanding all these things, that which cell is involved, what is the function of that cell, and on the basis of the normal function, what function will be disturbed, and if the function is disturbed, what will happen to the body physiology, what symptom your patient will tells to you. So this was all about understanding PBL, and by solving a clinical scenario, by solving a clinical scene, by treating your patient in future. Inshallah, this will help you a lot. Thank you very much.